Good morning to all of you. Today we are going to start the first revision lectures. In that we are going to start the parental route of drug administrations. In the parental route of administration is defined as the administration by injections which takes the drug directly into the tissue, fluid or the bloodstream without having to cross the intestinal mucosa. Advantages: action is the faster and definite. Gastric irritations and vomiting are not provoked, can be employed even in the unconsciousness or uncooperative and vomiting patients. No chances of the interference by the food or digestive juices and the liver bypass. Disadvantages are the preparation has to be sterilized. It is costlier, technique is invasive, and the pain assistance is required. Chances of local tissue injury and risk at the times. Next question is the write the structure and the uses of head and toins. Head and toin are the structurally related to the barbiturates, but is divided of the six oxy moiety. They are cyclic monoacyl ureas and are weaker organic acids than the barbiturates. Structures of the head and toin and phenotioins is given here. Example is the phenotine or dilatin. Uses: it can also be used in the treatment of all types of epilepsy and for the trigeminal neuralgia. It is useful for the treating the cardiac arrhythmia, especially induced by a dialysis. Side effect: dizziness, itching, skin rashes, vomiting with blurred visions, tremors and fevers. Next question is what is meant by the CNS depressant. The drug which have the depressant actions on the CNS as its principal pharmacological action is known as CNS depressant. There are two types, that is non-selective CNS depressant. These are drugs which produce a generalized depressant action on the central nervous system. They include the hypnotic and sedative, general anesthetics, central muscle relaxants. Selective CNS depressant: those drugs which selectively depress certain regions or the portion of the CNS are known as the selective CNS depressant. They include the tranquilizers, analgesic, anticonvulsants. Next is the question number 4. Explain the terms. In that first term is the pharmacodynamic agents. These are the drugs which acts on the various physiological functions of the body. They are further classified as follow: non-selective CNS depressant, example hypnotic and sedative; CNS modifier, example tranquilizer; CNS stimulant, example antidepressant drugs; adrenergic stimulants and blocking agents; histamine and antihistaminic agents; local anesthetic drugs; cardiovascular agents; hematological agents; diuretic agents. Next terms: Next term is LD50, the median lethal dose. This is the dose expressed in the milligram per kilogram, which would be expected to kill one half of the test population of the same species and strain of the bacteria or the animals. The minimal dose to cause the death of the 50% of the test population is called LD50. This dose in general is known as tolerance or threshold dose. What is the oral route of drug administration? Question mark. Mention its any two advantages. It is the most commonly employed route for the drug administration. Drug, whether the liquid or the solid preparation, is placed in the mouth cavity and is chewed or the swallowed along with the liquid like water or the milk. Advantages: it is safer, more convenient, and does not require assistance. It is painless and the medication need not to be the sterile. It is economical. Both solid and liquid doses form can be given orally. Disadvantages: the onset of the drug action is slow, therefore not suitable during the emergencies. The route may not be useful in the presence of vomiting and diarrhea. Cannot be used for the uncooperative and unconscious patients. Certain drugs are not absorbed by this route, example streptomycin. Next is the question number 6. Explain the term generic names. Generic, official, common, or non-proprietary. This name refers to the common established name by which a drug is known as the isolated substances, irrespective of its manufacturer. The first letter is not capitalized. It is chosen by official agencies. WHO has been official agency to select the approve and disseminate the generic name of the drugs. Next is the what are the drugs? What are the requirements of an ideal drug? Drugs, according to WHO, a drug may be. According to WHO, drug may be According to WHO, drug may be defined as any substance which is used or intended to be used for the modifying or exploring the physiological system or pathological states for the benefits of the recipient. Requirements of an ideal drug: it should be acts on the system with the efficiency and safety. When the drug is administered to the body, its action should localize at the site where it is desired to act, but its actual practice, there is no drug which behave in this way. It should not be have any toxicity. It should have minimum side effects. It should not be injure host tissue or the physiological process. Explain the monolithic devices which used to administer sustained release formulations. Monolithic devices. This is the most common devices for the controlling the release of the drugs. It is relatively easier to fabricate The doses release properties of the monolithic devices maybe depends upon the solubility of the drugs in the polymer matrix or in the case of the porous. It is relatively easier to fabricate. Doses release property of monolithic devices may be dependent upon the solubility of the drug in the polymer matrix or in case of the porous matrix. For the low loading of the drug is released by the solution diffusion mechanism, but for higher loading, that is, higher loading means 5 to 10% weight by weight, to release the mechanism is complicated. Then what are the different doses form in which drug can be administered? Explain any three. Pharmaceutical can be marketed under the many different dosage form. Aerosol. Aerosols are the suspension of fine solid or a liquid particle in the gas used to apply drugs to respiratory tract. Example, spiroquine used in asthma. Capsules are made up of gelatin or gelatin mixed with glycerol. They are used to unpleasant medication. Example, antibiotics. Creams are in the form of jellies, lotions, ointments, and first are used for the external applications. These are the solutions of the drug to be instilled into the ear, eye, nose, respectively through the dropper. They are the fine dusting powder. They are the fine powder for the external use. This is the individual name selected and used by the manufacturer. If the drug is manufactured by more than one company, each firm assigns its own property names. It should be written such that the first letter of each word of the name is in capital. Example, aspirin, which is acetyl salicylic acid, is marked under the different trade names like aspirin, ecospirin, aspro, and acin etc. What is pharmacopoeia? Explain its importance. Pharmacopoeia, a drug and the protein means to make. Pharmacopoeia is direction and the requirement for the preparation of the medicine. It is a legislation of the country. It sets standard and obligatory quality indices for the drug raw material used for pharmaceutical preparations. The synthesis of the drug phenytoin. Phenytoin synthesized into two stages. First is the preparation of the benzylic ester. Second reaction is the condensation of benzylic ester with the urea. In the preparation of benzylic ester, the reactant material, the benzaldehyde. Reaction condition is the KCN, C2H5OH benzoin condensation. Give the benzoin, which on dilute initial gives the, which again on the reacting with C2H5OH benzylic, the benzylic acid ester is the form. So remaining part we will discuss in the next lecture. Thank you very much.